welcome. I think in this room we had three groups of doctors. The first one is the 𝚑𝚑𝚗𝚂𝚑 for ultra call. Welcome. Can we have a big round of applause for welcome? The second is the international attendees from Vietnam. 𝚬𝚘𝚗 and 𝚬𝚑𝚘𝚗. 𝚬𝚘𝚘𝚗. What is it? Goodbye. Okay, not now, not now. 𝚬𝚘 and 𝚬𝚑𝚘𝚗. And clinical fellows from 𝓱𝓸𝓸. Thank you very much. So today, for these three groups of attendees, you will have different roles, so which I need to inform you first. Oh, this is not the course that is hosted directly by 𝓱𝓸𝓸 Hospital, but as a facilitator, I want to make everything smooth and fun. So for the first group, for the KOL doctor from Thailand, I think there is 26 of you who will attend the lecture in the beginning, and in the afternoon time, and after observing the live demonstration, in the afternoon time, you all will have to chair one patient for two doctors. Each of you will treat one side of the patients. So the indication for today is neck and hands. So which means you had to divide and conquer. We prepare 4 rooms for injection. So which means each of you will have 3 rounds. So 6 participants, 6 injector per 1 room. You will have some of the faculty from 𝓱𝓸𝓸 Hospital alongside with you, helping you. If you handshake, we will support you. We'll give you moral support and also snack if needed, in case you have low blood sugar while injecting. So that will be done, and hopefully it will be done by 4 o'clock. I know that you all are, experts, so it would be quick. We prepared too long, like 3 hours, but I think we will finish by 1 or 1.5 hours for sure. So that is the first thing for the first group. The second group is the Vietnamese international doctor. Welcome you. Unfortunately, I didn't know before that you are coming. I'm so sorry. So that is why there will be a lot of hectic in this morning. First thing first, we need to bring extra chair, and we have to take out your video camera because it's occupied this space. At first, if I know before, I will arrange much better. I'm so sorry for that. This is so bad hospitality, but at least this is the best I can do. Second of all, if I know before, I can put us in the bigger place so you can all observe inside the room. But since again, I didn't know, what I can do best is we can arrange you the seat at the behind the glass door to observe the 𝚑𝚑𝚗𝚑 injecting. But I can manage to turn on the speaker in outside the room, so you will again hear all the discussion. And please, the Thai doctors, since we had international doctor, I know that usually we communicate in Thai, but please now, if we want to show the hospitality of Thai, please speak English so they understand what you are doing. Is that okay for the Thai KOL? Thank you very much. Last but not least, the free rider group, which is my fellow. You are attending for free, but no, you need to really help facilitate inside the room. So what you have to do is, attend the talk, and then in the afternoon time, you need to be responsible for the patient, taking care of them before and after treatment, and fix your room. So that is how you can get free lecture for today. Okay, without further ado, let's go on. After all these, what we need to learn for today, absolutely about PDO, collagen stimulator. We had already in the past the workshop and lecture on the face, but today we are in advance. So we are now moving on to the neck and hand indication. So we had 3 excellent speakers for today. The first one is Dr. Kwon Han-jin. So he is the innovator and the CEO of UltraCall company. So which is, we will learn a lot from him. From the last lecture, we already conducted the clinical studies. Hopefully the collaboration will continue. Okay, so please give a big hand to Dr. Kwon. So he will give us the talk on the application, the off-face application. But we also had 2 other excellent speakers. The first one is Dr. Liu Jae-wook, who was with us last time for the face injection. So he was talking again about using combination with hyaluronic acid fillers and subdermal PDO. For those of you who are familiar with the use of HA fillers, now you will know if it can be the combination and how we can utilize the combination technique. Last but not least, Dr. Anna Yoon Kyung. So who I just learned that we had a common friend who is Dr. Jack Kolanda from Canada. She is not only very beautiful, but she can still give you the tips and the tricks on how using the PDO, the showcase, you will show us a lot of cases on volumizing and lifting. So without further ado, I will start presenting you Dr. Kwon. Dr. Kwon, the floor is yours.
Okay, hi. Nice to meet you again, my doctors from Thailand. And also, thank you for your helping to open our workshop here, Dr. Langsma. So it was a little bit messy, but let's focus on the hand and the neck rejuvenation, because as you know, there are not much product which can inject safely with a good result for the hand and for the neck. Usually hand, I did a lot of fat graft. I do, liposuction, and I inject the fat on the hand, and also some soft fillers on the hand. But many of the cases, we have some good result, of course, but we have these irregularities and some swollen look of the hand. So if you see the PDO, it's much more easier and safer and produce a good result. We also did many cases before with the PLA products for the body, but it has some hardenings and some nodules-like problems, especially soft skin area. Neck, a lot of nodules with the PLA products. So we can go over it with the PDO. So I will be showing the videos how to do it. Of course, if you are doing thread, you can do combination for older people. Because of course, PDO is one of the best items for the neck, but it doesn't mean it will do everything 100%, okay? So it will help it. I mean, the things which you were not to do before, you can do it. But still, some older people, we need some thread and some other combinations. But I'm sure, like machines, like a Thermage or Ulthera or many energy devices, they will not help neck too much. They can help, but that is a kind of a minimal improvement in my experience. So I will just review a little bit of the PDO, then we'll go to the video because we have a short time today. So I will pass all these. Just remember this one. When you put foreign body, there will be a collagen stimulation surrounding the foreign body, okay? That's very true, right? So this is a thread cross-section. This is a thread, mono-thread cross-section. You can see the surroundings with the collagen fibers producing. We will go past all these things. And as you know, we have many collagen boosters right now in the market. And the most famous one, Sculptra, the first in line, it started in Korea 13 years, 14 years ago, okay? But as you know, all the time there is something new, something upgrade, something better came up, right? So that actually, there was a PLA, which is similar to PLA. And then there was another one came in Korea about 7 to 8 years ago, PDLLA. So actually, these three things, and there are more copies in Korea right now, okay? Olidia, so many PLLAs in Korea. But they are same family, polylactic acid. So they share same characteristics. And there was a calcium and PCL, Elance, which is also famous in Korea, Singapore, Hong Kong, in many countries in Europe. And finally, we had the best product, which has less complications and more safe to use. Right now, this PDO, UltraCold, especially in Gangnam, South Korea, very good indication which other collagen stimulators cannot follow is the under eye area. Okay, under eye, it has a very good indications and it's going up rapidly. So that is a very product which can do safely under the eye. So many papers show shows the PDO has a better collagen stimulation than PLA. Okay. I can answer you any question regarding them because I've been doing a lot of meltings with the RF cannula. So the concept is here. You put PDO or whatever collagen stimulating product, and there is a collagen fibers produced. And of course, the best result, best is this product will fully absorb and go away. In Korea nowadays, all the patient, they will ask you, Dr. Kwon, is this safe? Then you know what is the measure of the safety? Is this fully absorbable? Okay, that is a Korean patient smart, and they always ask these things nowadays. So even older people, young people, they ask you almost 100%. Older people, they ask you whether this is fully absorbable or not. So something remaining long, like a PCL, remain 2, 3, 4 years. Now, still I have a lot of patients coming after the PCL, the 𝚬𝚘𝚗 and the Sculptra, whatever, because I do a lot of melting the fillers, 13 years. I've been melting the filler 13 years with my RF cannula. And I did some YouTube, YouTube. So they come to me from all over the Korea, from the provinces. They want to melt the filler. Just last week, a few days ago, I had 2 cases of the PDLLA. They put under the eye and big nodules. I remove it. I found out, this is a very new find. I found out very newly. Polylactic acid melting point is 140 to 150 degree. So Sculptra melt in 140 to 150 degree. I told you they are polylactic acid, they are same family. But poly-D-L-lactic acid, called the juver in Korean, their melting point is 230 degrees. So that's why when I melt with my RF cannula, this PDLLA is more stony hard, more rocky hard, and they don't really dissolve well with my RF cannula, okay? So you have to understand this family, but one thing common, very hard. So before, I was thinking, because they say, if you put the polylactic acid 3 times, and they will produce more volume, right? That's what we know, right? But what I found out is, it's not the real volume, it's a fake volume. You know why? If you put the polylactic acid, they become hard. And then, if you put second time, on top of the hardness, another hardness. If you put third time, on top of the hardness of the previous polylactic acid, another hardness. That's fake volume. You have to understand. It's not a true collagen stimulated volume. They may stimulate collagens, of course, but because I've been doing the melting a lot of cases, every day I do 3 to 5 cases of filler melting. And most longest HA filler I melted was 15 years ago. Patient put the filler, HA filler, 15 years ago on the nose. She's a very famous actress. Actually, she's doing the movies right now. She's very hot right now in Korea. And then I was doing the thread lifting, but I see the widening. So I was asking her 4 times, did you put anything here on the nose? She denied. Oh, Dr. Kwon, I never put anything on my nose. Are you sure? Are you sure? Because I asked 4 times, can you imagine? I see something broadening. So while I was doing the thread lifting, I melt this area and I squeeze out and the filler came out. So I asked her, why did you told me a lie? Why did you tell a lie to me? And she said, oh, Dr. Kwon, I'm sorry, I didn't lie. Because I remember now I put the filler, some kind of a filler, 15 years ago. That's why she was thinking it's all gone. So she didn't remember. She didn't even mind it. So the longest filler I melt was 15 years ago. Even last week, I melted 14 years fillers ago. She put the filler 14 years ago here. So please remember, even though HA filler we think most safe, but please don't put too much in one area. So the trend right now in Korea with the high-end doctors, we don't put too much fillers and we put even spread techniques, okay? It's very important. No one can remove this one with a higher lace. There are uncountable patients, they come to me, they put the higher lace injection 4 times, 5 times, but they never go away. So today we have to focus on the, not the RF cannula, so I will just go. So this is an ultracool. This is a sculptra. We have a 2 product, ultracool 200. The average size actually is coming out right now. Yeah, this is a sculptra. You know, some people say nowadays sculptra has a less problem because they do more dilutions. Dr. Liu, how many dilutions did we do sculptra in Korea? 10, 7, 9 cc. So latest, some Korean doctors do 9 cc dilution or 10 cc dilution, but still the nodule is coming up. And also they say they reduce the size of the sculptra. You know, our ultracool, we have a 5210, and we have a ultracool 100, 2250 micro. So even though you reduce the size, this nodule will come not immediately after 6 months or 1 year. Sometimes they come up after 2 years, 3 years, 4 years later. Do you know that? We have a lot of experience in Korea. We've been using it 14 years. Can you imagine? And this is a sculptra because the shape still atypical. Because recently I took the sculptra and I looked into the electronic microscope. The shape was still same with like this, okay? So nothing has been changed. And Acetafil, also Korean one, because it's a polylactic acid, they remove one L. So, because during the time when they produced Acetafil, there was a patent of the sculptra. You know the patent protection for 10 years, do you know that? So that's why they was not able to copy exactly same. They remove one L, and this is a Acetafil. They also have irregular shapes. And this is a PDLA, the Korean one called the Juveruk. They said they have a perfectly round shape, but we took the product, we looked into the electronic microscope in Aju University, it's also a big university in Korea, and then we found out their shape is not really regular. So sometimes you don't believe what the manufacturer says, okay? So we have to clarify it. We have to verify it. So anyway, the shape looks like this. And you know the world famous Lancer from Sinclair. Do you know Sinclair Lancer? This was very famous in Europe and many countries. They have a good shape. So you have to admit sometimes it has a good quality. The only thing is their choice of the material was not very good. Why? You know, I've been using PCL thread, and actually UltraV has a PCL and HA. I made it already 7 years ago with a patent. But why we don't introduce the PCL or PLLA? Because I found out PDO is most safe. Anyway, the PCL, the biggest problem is melting point is very low. So melting point of this product is of 58 to 60 degree. So when it comes to the hot temperate countries, if you don't do well, refrigerated delivery system, it will have a melting problem. Like this, a lot of clusters. You see this one, aggregations here? So when it becomes bigger and 4-year lasting, what will happen is your macrophage cannot digest this one, and then again they will try to digest again and again and become big nodule and granuloma. Okay? So granuloma formation, there are many factors: shapes, tumor stimulations, and the duration lasting of shape is actually a little bit better than sculpture, but still irregular. So this is the size of the UltraCore 200, average 50 to 120, but most average size is 70 to 100 is about 59%. Okay, and 50 to 120 is about 82%. So this is UltraCore 100. The average size is 20 to 50, but most size are located here 66%. Okay, so the size is also important. Why this issue came out in Korea? You know, this is a Jumruk PDLLA from the Korean product. They say they have a less nodule, and we found out why. Because they have many small size particles. So they have many small size particles, so they have a less nodule. That's correct. But because of that, they have a less effect. You got the point. Because our macrophage is a 25 to 30, so which belong to below 30, they might digest immediately after a few weeks after. So there is a less nodule, but less effect. Okay, that's the fact. So PLLA melting point is 140 to 150 degree, and they are very glassy state, very stiff. So if you do sculpture 3 times, and then you go inside to do some fillers or thread, you will feel the very stiff, very hardness. And it lasts very long, okay? Okay, I tell you one big difference with the PDO, UltraCore, and PLLA. PLLA, after 3 sessions, you go in stony hard. After 6 months, still stony hard. After 1 year, still stony hard. After 2 years, still stony hard. But PDO UltraCore, after 3 sessions, you go in after 3 months. After 3 months, also hard. But after 6 months, 1 year, it's a soften. You got the difference. They have, of course, the hardness immediately after few months. But after 1 year, you go inside after 3 sessions of UltraCore, you feel soft. So I call it soft fibrosis, okay? Because I've been going in uncountable cases every day, so I can tell you exactly what's the difference. And polycaprolactone, rubbery state, because we also have a lot of nodules from Alance PCL. So I go in, they feel like a little bit, like a hard marshmallow. The feel is different, okay? The PLLA, polylactic acid, whatever, they feel very hard, but this PCL, softer, like a soft, hard donut, So something very different from the PLLAs. So anything lasting more than 1 year produce nodules, chance of produce granuloma and nodules. But PDO, some people say PDO also produce nodule, but I tell you the main difference is if you shoot too much under the eye with a PDO, of course they may produce lump-like. But the different thing is after 5-6 months, they go very softened. or you just do one-time dissection, even not RF cannula, your manual cannula, they will break away. Okay? PDO immediately, or they can produce small nodules, of course, but they will definitely go away. So that's the difference between the polylactic acid and PCR and the PDO. So this is Juvero PDLLA, poly-D-L-lactic acid. They have immediately, especially the, what do you call this one, skin booster, they have an immediately brightening effect, of course, because they contain 15% of the hyaluronic acid, non-cross-linked hyaluronic acid. But the thing is, I show you the sizes, because they have more sizes between 10 to 20. They don't have a long-term lasting effect usually. And then you can see here, melting point of the PDLLA is 230 to 240. So they are more stony hard, and they don't really go away after the nodules. Okay, so this is the 𝚬𝓷. I don't know yet, but in Korea we don't still have the Korean FDA yet with the 𝚬𝓷 because of some of the too much inflammation and safety issue. So I don't want to talk too much. So, but we can suspect they have the ingredient called the PEG. Have you ever noticed about the PEG, PEG, polyethylene glycol? Because this was the main ingredient of the COVID vaccine. Do you know COVID vaccine also has a lot of complications and allergic reactions? So this maybe give rise to that kind of adverse reaction. So please take note of the PEG, okay, PEG. And this, they say this is a liquefied PCL, but still produce a lot of granuloma if you shoot in one area too much. Okay, so we had a lot of experience from Singapore's, Malaysia's. They have a lot of nodules, granulomas lasting more than 1 year, 2 years with the 𝚬𝓷. So please don't inject one area too much. Okay. Actually, this one shows there was one doctor who inject this one under the eye too much, and then he claimed that there is a granuloma from PDO. So they did a biopsy. So there's a difference, okay? This is about the PEG, polyethylene glycol. So it causes an acute systemic allergic reaction called anaphylaxis, and anaphylactic reaction due to elevated level of antibodies to PEG. So please take note of this. Is kind of a interesting, So I already told you many times, PDO is a hydrophilic, and PCL, PLLA is a hydrophobic. And because it's hydrophilic, it attracts a lot of cell adhesions. If there is a lot of cell adhesions, there is a collagen stimulations. Okay, so we have a lot of comparisons. Okay, time is running so fast. I have to show the video first then. Okay, so today we have a topic about the neck and the hand. So let me show you this patient has this what we call platysma, loosening of the platysma, and then the skin become very loose. She's late 40s, 48 to 49, and this was after the treatment. And this is the patient with hand problem because she is pretty, but her hand looks very skinny and a lot of fine wrinkles. And she told me she is ashamed to put her hand into someone's, So she had a lot of blood vessels, so veins. So this is after 2 months. Let's go to the, so this is the patient. This patient, actually the same patient, when she do like this, she do something like this, and she have these wrinkles appear more, and then it is the same patient, the without expression, with the expression. So this is immediately after the treatment with the ultracal 200 and some thread with a piece tornado thread and with some of the mono thread. So I will show you the video first on the hand. Why the video is not coming up? Can you call someone? Oh, here. Okay, this is ultracal 200 4cc dilution. 4cc dilution, and I'm using about one and a half vials for both hands. Of course, if you can use one vial, one hand, one vial, one hand, only one treatment, it will last about more than 1 year or 2 years, okay? And I'm using 23G 5 centimeter cannula. You can do the puncture point between second and third and fourth, between fourth and fifth. Okay, it's very easy, very simple. And just remember, do some spreading techniques, fan techniques, slowly. So please remember, one line you inject 0.1 cc, then it will make you very even distribution of the product. Okay, even distribution. And another puncture. And our product is after, the PDO is after the collagen stimulation, right? So usually we go superficial, subdermal layer, don't go deep into the muscle layer, okay? Because some products, when they inject, they also tell you to inject in the muscle layers. That is one of the reasons they cause a lot of nodules and granuloma formation because of the movement of the muscle, It happened with the PLLAs. So you see, we are after very superficial layers. Don't mind the deep layers. Of course, now we have some HAs. You can shoot HA in the deeper layer and the ultracal on the superficial layers. That is also possible. So it's a very simple and very easy. So please take note, it's a very superficial, okay? Okay? Where is it? Where is 어디 갔어? So this is after 2 months.
USB
The USB here. Okay, so this is the neck. Actually, some of the people without expression, they have a not bad, but you see with the expression, they have a lot of wrinkles, especially in the mid area, okay? And they do this one with the many other machines, Thermage, Ulthera, whatever, but usually they told me they don't see any effect at all, okay? So that is very helpful with the UltraCold. So the entry point usually I made is, along the wrinkle, because this wrinkle line, okay? So the very, usually ladies have a 2 or 3 horizontal wrinkles. So we make the puncture point at the wrinkle line, and I'm using 7 centimeter 21G cannula, okay? A little bit more thicker than the face, okay? And I try to put more on the wrinkle line here, okay? If you want to improve this wrinkle, you put more, and actually you can do UltraCold 100 from the outside superficial injection. But anyway, so this is really easy. Just to make puncture again, fan technique. You know, with this, we have a lot of good results from Europe, especially Spain and Italy and those countries. They do a lot of neck rejuvenation with the UltraCold 200. And they do only UltraCold 200, they have a great result. Do you know that Caucasians have a more better result in the treatment with the fillers, threads, and all these collagen boosters? So they really do a lot of cases right now in Spain for the neck. So just do it, fan technique again. So I'm using 1 vial, okay? 4 cc dilution, so 1 cc, 2 cc from the right side, and 2 cc from the left side. If you notice here, can you see, it looks like there are a lot of adhesions? So neck is not that easy area to treat with the machines, okay? And even with the fillers, when you put hyaluronic acid fillers, some people looks okay, but some people along the wrinkle and the filler migrate up and down. So they have these lump-like lines up and down of the wrinkle. Okay, I've seen many cases like that, because many Korean doctors also put the filler along the wrinkle line. Okay, so it's not a good technique. Can you see? It's quite very adhesions are very stiff. So actually, with the UltraCold, if you do some dissection, and the result is much better, okay? Only the area you have to be careful is under the eye, because you have more bruises and swelling. But the other area, actually, you have no problem. You will not have any bruises here with the cannula, unless you are very unlucky. So do some dissections. Can you see the adhesions? Okay, so do some dissections. Okay, so this is it. Okay, you can end up here. But I just want to show you a little bit more information. You can combine with a thread. So I always tell you, don't underestimate thread, okay? Thread is still the best of the best. So if you combine thread, the result is much more better. This is a tornado, okay? Very simple collagen stimulating 60-80 tornado, okay? I go a little bit fast forward. And the wrinkles here on the neck, if you go horizontally, you don't see the stretching effect. Okay, even you use same number of thread, let's say you use 12, but if you go horizontally, you don't see the stretching. But if you go vertically, you will see the stretching. So that's a very big difference, okay? But we cannot go 100% vertical because of the neck is difficult, so we go slightly vertically, okay? You can use double twist. This is a double twist or tornado, okay? But tornado is more painful, so sometimes I'm using double twist. Okay, I just go fast. Okay. Other side also same. Vertical, semi-vertical, about 2 layers. Okay, this is a very important one. Dr. Kwon, mono has no effect or has a less effect. Why don't you use the cog or mold thread on the neck? But to improve this platysma band muscle, you have to put the mono thread into the muscle. So this is a intramuscular, okay? I'm injecting the mono thread intramuscular. It's not a superficial layer. The only area I put muscle is the neck and also SCM, substernocleidomastoid muscle, and masseter. Okay, that is the only area I put the thread into the muscle. But the other areas are subdermal layers. Anyway, so this treatment was done, and this is after 2 months. Okay, so I asked her, how many % do you feel the improvement? She told me she improved 50 to 60%. So she did a second session last month, and then maybe she will come back after another some time. I don't know when. Because sometimes if you treat too good, they don't come back. That's a problem for us. And this patient, I asked her how many % she see the improvement. She told me she feel 80% improvement. Okay, so please try to utilize your collagen stimulator PDO for the hand and for the neck. You will see the new era of the beauty treatment in your clinic. Thank you very much.
Hello, everyone. Nice to meet you. I'm a Dr. Yu. I'm from Korea. Last chance I'm come to this hospital. My lecture is mixing HA and the ultra-core perioral infiltration. Now my lecture is HA filler for the higher filler ribs. We can use many filler in every face site. So some area we can use only HA filler. Some area is mixing HA and ultra core. My lecture is some mixture method and only higher filler method. So higher filler is the 3 types of HA filler. One is fine, one is medium, and one is hard. For a long times in Korea, we can use higher filler in Korea. Now times in Korea we can use this filler also. One is very little particle is UltraV higher filler fine. The medium size is UltraV higher filler medium, and large size particle is example. The hard is forehead, nose, and jawline. We expected the ultracore indication, and the advantage of ultracore is low eyelid modification and the tear throat tightening and perioral sunken tightening and marionette correction. And some patients we can use ultracore, lateral cheek lifting, and some poor, for example, acrylic scar, we can treat by ultracore. Higher filler characteristics, many have characteristics. It is combined monophagic and biphagic. We can call the multiphagic filler. It also have dual effects. Some viscosity is very good, something is elasticity is very good. And we can use higher filler for volumizing. You can use higher filler, very easier technique, and smooth injection and free handling movement. So dermal area we can use the filler injection for diminished line of facial area. And the dimpling site, increase the volume, we can use by filler. And subdermal injection, something prominence and furless. And we can use dermal filler by soft filler infiltration. It's very effective. So some periorbital and perioral is very superficial layer of soft tissue. So we can use periorbital tightening infiltration is by ultracore and other higher filler, for example, fine filler. And we can use first the periorbital line crossing ultracore, and then the HA filler for higher filler, layer by layer infiltration. We can correction the low phase modulation. So we can bony layer and filler, and the superficial layer is ultracore. It is a perioral tightening. And the advantage of the mixture is longer duration and double layer augmentation and dual volumizing and tightening, shaping, fullness, and ultracore superficial tightening and dim layer, higher filler, volumizing. So perioral infiltration of method, 1 or 1.5 cc ultracore, and then the advanced treatment and the crossing marionette and the repeatory crossing injection. So the target layer is a superficial layer. The dim layer is a higher filler layer. Combine the forehead, only HA filler, and around the eye, ultracore, and then the HA filler, temple, higher filler, perinasal, higher filler, or ultracore. Lip and mouth, higher filler. Jaw, perioral, cheek is a mixture, and jawline, only ultracore. So she is Angelina Jolie. She's a very attractive actress in the world. So 80 years is very cutie and very younger. So 43 years is after maybe 35 years later, she is more important point is the rib is very shallow ribs. So many women after years, she's the sunken eye and cheek dimple and shallow the ribs. So she's a Korean actress, very famous actress. Her rib is very attractive. The Bermuda border, the rim line is very attractive, and the bottom margin is very lumping. So this is a very attractive rib in Korea. So we can talk about the rib filler by 𝐻𝚑𝚗𝚗 higher filler. Rib is a very important feature, and the rib is a very attractive appearance make you. So several years use the rib filler. Rib augmentation is before very shallow lines, and after filler is a very attractive line. So anatomy is the complex mucosa, muscle, fetish. They have many different types. So by aging is skin loses, skin lose, elasticity, and visible change. So the 𝚁𝚘𝚗-𝚂𝚐𝚗 and Cupid's bow and oral commissure, we can emphasize this point. Beautiful lip filler. What feature make you for beautiful lips? Pronounced Cupid's bow and defined Bermuda border and oral commissure. The lip filler is a 3 technique injection, and linear technique, tenting technique, and Wallace technique. Linear technique is with cannula and prior to Bermuda border and retrograde injection. Tenting technique is red mucosa more unrolled and exposed. White roll elevation and dislocation of gall and palpable deposit and dividing to pores. And the upper ribs start oral commissure and end the 𝚁𝚘𝚗 point. Lower ribs from the oral commissure away from 2 millimeters starting injection. And lip tenting technique is entry point and this advanced and injection infiltration. And Wallace technique is linear retrograde administration and combine to different method. And it is a very painful, and we must prepare with the anesthetic methods. Rim line filler and Botox upper lip, vertical line Botox, Cupid's radial filler line Botox, and 𝚁𝚘𝚗 line and rub technique filler. So lip filler journey in the world, in Korea is also. So after 1 year, very small and very shallow ribs. And 2 days later, very swollen. Because the ribs have many murder, and so after injection, after 2 days, during the 2 days, very swollen. Some patient complain the doctor. So bleeding after 3 and 4 days, and after 1 week is this complication and side effect improve. So very lovely lips have after 1 or 2 weeks. So risk in infection and the scarring and bruising. So we can use vitamin K and another the treatment, general treatment. So it is bruising, yes. Went to see the doctor, bruising and swelling more than 1 week, and skin color change, and we can use the 𝚑𝓸𝓸 and the corticosteroid. So this is emphasize the oral commissured and the upper lower facial line. So it is also this is oral commissured mouth corner emphasize. So now this is for the video for ribs. Upper ribs is emphasizing mouth line and the mammalian border emphasizing and the 2-point portion of lower ribs, the filler injection. So lateral view. The temporal filler by medium higher filler, we can use this. After then the injection is the dimpling is disappear. So we can use video.
말을 한다고 치고 이 손으로 여기 5포인트 묶고 이 꼬리는 여기 양편입니다. 그래서 먼저 꼬리를 주세요. 이쪽에서 들어가서 입술 라인을 먼저 만들고 다른 라인도 먼저 만들고 그래서 각각의 꼬리를 채워줄 겁니다. 텐팅 시켜요.
Okay. This is a lip filler. We can emphasize the point, and the low entry point is central and oral commissure. And the first entry point is philtrum, and upper lip, lateral border of lips. This is a tenting technique, and tent the mammalian border, so retrograde injection. 이거 빨리 하자. 더블 스페이스. And the other side is also, and tenting the commissure or the border, and hardness upper rim margin. So, and then the mouse corner, you can use a commissure entry point and the retrograde injection. I use the higher filler fine and medium. So we make the right commissure, mouse corner elevation. So some volume, some hardness is very attractive mouth corner. And the other side, and the tenting the retrograde injection and the make the mouth corner elevation. So tenting the commissure and the mouth corner, we can make the voluming and the something like the elevation of mouth corner. So low ribs margin is also emphasizing and voluming the lumping technique. This bolus technique is one side. The other side is also at the point is center and advance and make the volume the other side and the balance. So you can use this. This is a final. The other endpoint is the middle central. So volumizing. Okay. So this is fine. So emphasizing the other side and smoothing volume. And bolus technique. Many Korean patients like this. So the elevated mouth corner and emphasizing is 1, 2, 3, 4 points. Okay, by ribs. And this is a medium for the temple and touch the bony structure and retrograde injection. We can expand the temple, the center of the temple site at the point, and we perpendicular injection by 𝐻𝚑 pillar. So above the bony layer we can use. So only this area injection. Here is not because this area is something the smooth line, but there is the widening the forehead. So we must inject only this area, rectangular area. So the other side also. The other side is so perpendicular straight inject and the bony structure fill and the inject 𝐻𝚑 filler. So to deep and to strict the direction and then repeat injection by higher filler. So the other side also. It is very simple and very easier method of temple area. This is so. My lecture is 2 points. One is a rib and one is temple. So I hope higher filler you make the by higher filler for the rib and temple. So congratulations the publishing of higher filler in Thailand. Thank you.
There. So we talked about face like previous 2 doctors before. Now I'm talking about the hip part. I think it's kind of a very interesting subject even in here because I heard it's very famous and very common, like being a lady boy, and very transgender. So in Bangkok, even I heard a lot of Korean people flying to the Bangkok to doing the transgender surgery. So this is very good to have some combined to gender surgery, or even for just a woman who having the hip lifting. So I'm using like 𝚑𝚘𝚘 200 powered PDL, making soft hip voluming and the lifting. In Korea, we called it like apple hip. Like a hip is very glow and shine and having nice volume. So I'm Dr. Anna Jo. My clinic name is 𝚑𝚘𝚗 Clinic. So I'm gonna skip this part. I was talking about some beauty trend. Of course, we're doing some double eye surgery, nose job, and some lip augment with the filler. And people are doing some two-jaw surgery and making round feminine surgery as well. And they doing breast augmentation and making slimming leg and slimming waist with the liposuction or lipo-injecting things. Now the people are asking to me about making the apple hip and making a lot of bigger hip and tightening hip. It's like latest trend in Korea. Are we going to talk about the anatomy about the hip and pelvic part? It's not much a lot like a face part. We just having like gluteus maximus muscles and gluteus medius muscles, but inside we having like a some piriformis muscles, which is important. Because it's a close technique, we are reaching from the outside to the inside. So this is a part of you have to understand to do this treatment. We can see like this iliac crest on the top of hip and posterior superior iliac spine on the middle of hip. You actually can see this part. And when you see my video, we have to check our trochanter head. And of course, we have to check the coccyx because it's in the middle of the line of the hip. And we have to make sure nice hip line. So this is other part which connected to with the hip. We have to make a nice dojump and plank line, having nice shrink with waist. And we have to fill it up with the hip dip. And you shouldn't have a lot of fat on the saddlebag. And a nice straight side. And making nice clear line with the buttock line. So our face is aging, our body is aging, of course, and hips aging too. So as aging process, just as face aging, body also aging. When our hip is sagging, our side is look like more shortening, and the waist is also look like very long, which doesn't look like a beauty body portion. And when hip dip, this part is getting lost. Soft tissue and fat tissue is getting lost, and there's no structure which it can support it to hip. So when we do the design, and hip volume which is important, and making nice hip line, and we having some trochanter to pressure, we have to fill it up, and even we also have the skin texture making better. So it's the same talk about when hip is getting lifting, our leg and side body portion is getting longer and looking much more nicer. This is also important, like when you're making hip design, it's important about the ratio. And the ratio is 0.0 and 0.8 is very nice ratio to making look. So if you have a patient who asking for making nicer hip, you have to also making the waist is much slimmer. So there's a lot of way we can collect hip collection, but not also we can say it's a lot of way because some of a part of silicone implant is in Korea. Some clinics doing, but like it's very illegal. But I think is that the legal here? Put the silicones on the hip. I think it's legal in here, so you can also like a silicone implant, and we can do the like a transplantation after liposuction, and we also can do the like a collagen stimulator with thread lifting. But sometimes if we doing some implant and long collection, we having some side effect. You don't want to have a side effect. You can't sleep at the home. You have to deal with your patient. Like that, if you have put a long size of implant, it look like very awkward. And sometimes if not fixing inside of it, it's going up and around. And this is one of a very common way when you do the hip lifting. You cut all the skins off on here and you just put the suture in. It leaves like a scar over 30 centimeters. And especially for Asian, we have a hypertrophic scars problem and some the keloid problem. So this is not the best way we can collect the hip. So while we're using UltraCol 200 and UltraCol 100, the most patient with the hip dip, they're skinny. So when we collect the fat tissue from the skinny people, the fat tissue is not very good condition to put in the other space. So the amount of fat that can come from the skinny patients are very limited. And in the end, hip plastic surgery included implant, fat grafting, other the procedure is the only way we can do the hip, making beautiful hip. So, and when you put like a hip implant or even the fat grafting, at least you need like a month or like at least 2 weeks. With lifting surgery, at least 6 months to need like stabilizing period. So surgical area is not just for small area. The hip part is very large and side effects can occur. And the blood supply is not good as like a face. So you have to like a triple X, be careful with when you do the body procedure. So advantage of the UltraCol, it's just safe. I have so many cases since it's coming out. Before UltraCol, I used to use like a Sculptra, but I just change it as soon as it's coming out because it's safe. And it's also collect volume plus lifting together. So you don't need to like another procedure together. So just only do the UltraCol, making nice voluming, also lifting. The risk is necrosis is significantly low. I can't put like 0 because I didn't do like 10,000 cases, but like it's significantly low. It also collects the skin texture together, and the procedure is easy. You can just try from the tomorrow, and it produces like a natural volume. That's the disadvantage of the UltraCol. You may not be satisfied with the volume, but like people asking me about doing these things because of the natural volume, they don't want to having like shoes and giant volume of the hip, and this is can be like a disadvantage or an advantage together. But the thing is, because we using like at least 8 to 10 bottles of UltraCol, the price is going to be more expensive than compared with the facial treatment. So this we're gonna see some cases, and we're gonna see the video after all. She is like a 35 years old woman who have like 3 children birth. But her BMI is just between 20 and 21. That meaning is she's not very fat person. She's a skinny person. But she having like 3 and 4 lines here and very black dots in here and very skinny hip part. So I collect the line with lifting and collect the hip deep part with the UltraCol. She is a 25 years old woman, have 1 childbirth, and her volume is fine, but like she's not happy with this wrong part of her hip, and she wanna collect, and her balance of the hip is very unbalanced, so I'm making the balance between this left and right. And even her hip line have like doubled here, so she wanna collect this together. So, And actually, she lived in America, so she wanna have like even she have a nice volume of the hip, she want a giant volume. So I making design to making more volume in here, and making good balance of this line to this line. So I'm making line collection with all those threads and making good balance with the hip volume. This part with the UltraV like this. You can see all this bottle to use to making a nice volume of hip depression. And this is final result. Her hip is very balanced, and this part of hip line is being balanced together. So this is before. Her hip is a bit different and sagging, and very long sagged hip. This hip is very round and big, and this part of line is very balanced. And she is 23 years old girl. Her hip is very nice, but like she lost a lot of weight, like over the 10 kilograms. So if you can close look, you see all the texture line here on the skin mark. She have a lot of skin mark in here, and she have so depression part of hip deep. So I collect her here hip deep part with UltraV too, and making a little balance between left and right to lifting up her hip. This is one of the important part of my case because she's 37 years old. The thing is she had the liposuction surgery before. So if you see the close look of the picture, you saw lots of cellulite and a lot of scarring tissue on the here on the side part. So I collect the skin texture with the UltraV 100 and making a little bit this cellulite part with UltraV 200 and 100 together, and like this. So even with this, I using like a 30 gauge of the needle because UltraV has a very fine texture. So even with the 30 gauge of the needle with the 10 cc of the syringe, it doesn't have any problem. So for face, I changed my method, but like I used to make like sterile water 5 cc mixed with lidocaine 1 cc, but nowadays I'm using like a 3 to 4 cc of sterile water and lidocaine 1 cc, so total volume is like 4 to 5 cc. And for body, because it's a so big and wide area, I'm making sterile water 8 cc with lidocaine 2 cc, so one bottle of UltraV making 10 cc. If you're using 5 cc syringe of the syringe, you having like two syringe. It's one bottle. 1, 2, 3, 4. So can you play? This is video. So when you do the design, it's making sure from the pelvic area go straight down to the side. And this is our part of hip line. This is important. And making sitting position, and you need to check the like a trochanter head part, and making up and sitting down again. When you collect this hip line, when you collect with like a thread or other things, this part shouldn't go over to the trochanter line. When you're fixing this second part of skin thread to the trochanter, when it's getting over, when patient doing the sitting down position, it's poking and it making a lot of pain. So this is UltraV. I'm using 23 gauge of the cannula. I just put like 1 point lidocaine. She's not under the sleep anesthesia. She's totally awake. it's not very painful part treatment. This is also what I like. This is like an octo twist thread, but we passed about this. Thank you. So we are out of time. So this is final result. All right. This is the older case of what I talk about, doing the thread and ultra-cold and fixing line. Even you're not fixing the line of hip line, just only fixing with hip depression. It looked like much better without any surgery. The patients can go work right after 10 minutes in the afternoon. They can walk, there's no pain. And even that is very nice, can bring the nice result if they having liposuction in the thigh. It brings very nice result. So that's all we talk about. My name is Anajo. If you have any question, you can just send me an email. I'm gonna write down after all the sections. Thank you very much.
Yeah, hello everybody. I'm Dr. Bích Na from Vietnam, and it's my pleasure today to be here and sharing with you some beautiful case of ultrasound combined with other treatment for the facial contour and total rejuvenation. Thank you. Yeah, it's my content share you today. As you all know, when we are aging, the change of our face occur in many different layers, not just in the skin. Yeah, with the skin we can see the wrinkle, the sagging, but with the fat paste, it lost the volume, and also the muscle it changed in the technique, the strongest, and also the bone it have some remodeling. So to approach the total face rejuvenation, we need the multimodal approaches because it's not only targeted on the tissue, but they also focus on the interaction, dynamic interaction between these tissues. So we need to focus not just on the skin, but also on the fat paste, on the ligament, on the adipose tissue, and also the bone. So we have many different choice for rejuvenation, such as the injection, the EBDs, or also threads and powder PDO. And today I will focus on some techniques and some way to combine PDO, powder PDO, with the other treatment. And the arm of the using rejuvenation techniques, it focus on the relaxation of the muscle, focus on the resurface, the volumize, the facial tissue, and also with the good combine, we can achieve the most natural looking effects. And here is some study, and all of the study conclude that when we combine different ways of treatment and multimodal approach to the facial rejuvenation, we get a better result, the long-lasting result, and it's almost not increase the adverse event. It means that it also the same shape, and it increase the result and the happiness of the patient. So with the powder PDO, we all know that it can use for the facial lifting, for the volume restoration, for the wrinkle improvement, the skin tightening, or the scar treatment, and the glowy skin also. But in my experience, I love powder PDO in two indications. That is the skin improvement and the facial contour, because it also have the lifting effect like thread. Yeah, and it's also can simulate the collagen so good, so that after the treatment, the skin quality of the patient will improve so much. So we have two kinds of ultrasound, yeah, for skin booster and for volumize. And when we compare that powder PDO the thread lip or the HA filler, we can see that maybe it has some the same. But in my experience, I love powder PDO for the skin quality improvement beside the lifting. And for the threads, yeah, of course, it's for the tissue repositioning and for the filler HA. I love it in the volume restoration. So when we have the pattern with the Asian skin, we can combine 3 of these. And the way we combine is up to our pattern, and it's up to the way we recognize what is the most problem in their face. Such as with the problem most is the loose of the fat pads, we use HA filler. With the problem that needs to repositioning, we use thread. And with some pattern that not aging too much, they around from 30 to 40 years, they also want the facial contour and also want to improving the skin quality. We switch to the powder ultrasound. So the way in my practice, I usually combine the powder PDO with the toxin, and usually for the upper face, the crown fit, the frown lines, the forehead line, I usually do the botulinum toxin in the same day with powder PDO, and especially for the periorbital area, yeah, it's so good if we combine together botulinum toxin with powder PDO. And with the filler, you know that the filler is for display the loss of volume by the fat pads. And in our face, we have 2 different kinds of fat pads. That's the superficial and also the deep. With some area that we think that the loss of volume come from the deep fat pads. That area, the filler is a good choice. But with some area that we have a very thin skin, such as periorbital, and also with some area that I think that it's more dangerous with filler, such as the forehead, sometimes with the temple, I will tend to use ultrasound, or I combine the filler with ultrasound, because I don't want to use too much filler in that area, because it's dangerous and also not unnatural looking. With the thread lip, usually we do the PDO and the thread in the same day, and we do the ultrasound first, and after that we do the thread. And because it's the same mechanism to affect on our tissue, that is stimulate the collagens. But the powder PDO is also for the volumize, for the restoration of volume. I think that's better than thread. So I don't know how going in Thailand, but in Vietnam, many patrons, they love EBDs. They love thermas, UltraV, HIFUs, and some other kind of energy-based device. So with the EBD, we usually indicate is for the wrinkle, for the sagging skin, or for the reduction of the volume. Especially for the face and the neck, some EBD such as the trident cannula, the IF cannula, or the HIFUs can reduce the face so good. So in my experience, I love to combine EBD with the powder PDO, and I can combine it in one day. If I combine it in one day, I do the EBD first, and after that, I do the powder PDO. But if I want to separate 2 sessions, I will do the EBD first. Because you know, when we do the EBD treatment, about 6 to 8 weeks later, the remodeling of collagens will begin. And at that time, if we combine with the powder PDO or we combine with thread lip at that time, it will help us to get a better result. So here is the multimodal approach for rejuvenation. Usually I have a 3 steps of this. You can image like we build a house. At first, we adjust the foundation. If the foundation have a hollow, we need to fix it. We need to fill this. And after that, we build the wall. And it's like the tissue repositioning by threads. And after on, we will paint the wall and decor our house. It's like a touch-up for the skin. So in the volume adjustment, if we want to increase the volume, we can choose the filler HA or the powder PDO. And if we want to reduce the volume, especially reduce the fat pads, we can use EBDs or such as HIFU or Trident. And with the step 2, the repositioning, we should combine the botulinum toxin with the thread lip. And when we want to combine the botulinum toxin with thread lip, in my experience, I love to do the botulinum toxin for the upper face. From the eyebrow and the forehead, the crown face, and also some pattern they have the lower face, such as the very big, the hypertrophic. I can do the botulinum toxin to smaller this first, and then after that I do the thread lip, and the space between two treatments is usually about 2 weeks, because many studies they told us when the muscle is released to the relaxing conditions, it will cover better to the filter when we do the thread lip. And the last is touch up the skin. In that last step, we can use cross-linked HA for some beautification indication, such as to augmentation of the chin, of the lip, to correct the nasal label folds. And if we want to improve the skin quality and reduce the wrinkle, or we want to touch up the natural looking of the skin, we can use the powder PDO at the last step. So you see, the powder PDO we can do at the first or also at the last step. So here is the principle of combine some treatment together. As I told before, the EBD, if you want to combine, you need to do before the thread lip or the PDO or powder or the HA filler before 6 to 8 weeks. Because you know, when we use the EBD with the high temperature, it can melting our filler, our powder PDO. And it also makes the thread is not strong enough. So if we do the PDO or the thread lip first, we need to wait about 2 or 3 months later to do the EBD. Because at that time, the results of thread lip or powder PDO is stable. And sometimes we can combine with some resurfacing technique, such as fractional CO2 or RF needle, if we want to improve the skin quality or treatment the scar, the wrinkle by the EBD, such as fractional. Usually we can perform it 2 or 4 weeks before or after the thread lip. And here is some principle to combine. If we combine not 2, but 3 or 4 or more treatment in one person, here is maybe you can look at this and you can do it on your practice, because as I told before, we have a total 3 steps. So with the upper face, the first step is about the botulinum toxin for relaxations, and after that, the volumized replacement by powder PDO, ultracount, or cross-linked HA. And after that, about 2 weeks, we can have the eyebrow elevation by thread lip, and the last one, we can touch up the skin with powder PDO and cross-linked HA. Usually in this step, I usually use the ultracount 100. age or ultrasound. And after that, we follow by the relaxation, the muscle by botulinum toxin. After that, we change to the thread lip, and the final, we touch up the skin. And it's the same with the volume reduction, because you know the Asian women, they tend to have a big face when they aging. Sometimes they have a very big mala, and they want to reduce the fat, not going to adjust or to augmentation of the volume. So in that case, we can do the volume reduction with many different choices, such as liposuction, cryolipolysis, or the lipolysis injection, or EBD. But we should do it first, and after that, we follow by the Botox and the thread lip. And with the next, we can do the tightening with EBD or the volume reduction first. After that, we also do the Botox and also do the thread lip, like the lower face. So I can share you some case of in my experience in my clinic. She 55 years old, and just with the powder video ultrasound, I inject to the forehead, the temple, periorbital, and here is the result after 4 weeks. We can see the result is stable now, and the skin improvement so much. So see a pattern that have the volumized. We can see many hollow on her face from the head, the temple, nasolabial fold, and also the malar. In this case, in my experience, I will combine the powder video with the HA filler. But because she don't want, she don't love to do filler, she told me that no, I reject the filler. So I do the ultrasound for her, and the volume is 12 cc full face. Yeah, here is some area that I do the adjustment with video. And because she gone to have a wedding just 3 days later, so I just have the after in the same day. She 55 years old, and you can see she have the short gain of the skin and also the muscle. So in this case, I do the botulinum toxin first, and follow with the ultrasound in some hollow, and then the thread lip in the same day. So here is the result after 6 weeks. And here is a person with the severe aging. You can see in this patient, I combine everything. I combine the botulinum I think that he is very happy with the results. So we can conclude that the way we combine the technique will make the pattern have the optimal result and the natural and also the harmonious looking. So here is a case with the next. At first, she come and she just want to do EBD. She don't want to inject anything. And after therapy, when I see her after 4 weeks, the result is not so good. So I combine the ultrasound at week 6, and here is the result. Just 2 weeks later, I think that the result is better with the ultrasound than the therapy in this case. So the conclusion is we can combine anything we have and anything we expert in our practice, but we need to follow the principle to combine. And with the good combination of the facial treatment, we have has the good result, the long lasting and the more natural looking for our pattern. Thank you for listening. Thank you.
Okay, hello. How is everything so far? Is this okay? Interesting, that's right. Today I will sharing about the case in Thailand. Okay, let's start first. Oh, not Sao. Okay. My name is Dr. Beam. I'm from Thailand. Now I'm graduate in Chiang Mai University. I have an experience in aesthetic field more than 14 years. And now I'm graduate from fellowship KCCS, Korean College of Cosmetic Surgery. So now I do at the aesthetic field and I do as a surgery on the face also. Okay, not so. Thank you. Because we have a little time, so sorry everyone. How do you feel hungry right now? I just want to say in your language, สวัสดีค่ะ 안녕하세요. And, oh wow, thank you, 안녕하세요. And are in Vietnam? Huh? 𝚬𝚘𝚗? Ah, wow, okay, thank you. I want to share the kiss right now. Okay, and then I'm a board certified preventive medicine, and I had an experience from 14 years in aesthetic and did the surgery for 7 years or so. Okay, come along with me with this scenario. First, once the patients come to you, and this is the first time, she never do anything before. And she have a limited budget, just only one procedure to make her improve from aging. Which one the best for her? Think about that. Someone think that we have to do the toxins? Yeah, everybody, yes, toxin, yes, toxin, here. Wow, it's look great. But this time she feel like $1 million. She's so wonderful, but she's so beauty. And she's come back to you. And she trusts you so much. And so this time, unlimited budgets. What's the next step to do for her? UltraV, 𝚬𝚑, auto filler, or yes, she do or. And then a step like this. Where's the poisons that you treat her from here and to here? How do you think about the progression? But you see, face looks so nice. But the problem is this area. Is that right? So from here to here, fantastic. But the problem is neck area. So what should we do for her? What should we do for her neck? Huh? Is she up again? Let's choose. Okay. 𝚬𝚘𝚗 panty, cover on the neck. Here, I'll show you. Here, better. But all you can do, another procedure for her neck. Is that right? So the next thing to improve here to here, very nice. Is that right? So why should we treat the neck area to make it homogeneous and balanced? Women need to be beauty and look natural. Yeah? Everybody say yes. Because it's, oh, I was born and sleep so well, but right now I'm so young, like that. Yes, there are some part of your body you can hide your age from many procedures, right? But there are some part always reveal your true age all the times. Face. So, we have known that the sign of aging of the neck first. The definition is the first sign. People come to you, say this turkey neck. It looks like turkey. And the second is vertical neck lines. The vertical lines different from transverse line. The vertical lines come from partismal band. And the third one is wrinkle and texture, like a cobblestone. Here, that's right. Very common in neck region. Yeah, and this is a problem. So that's our problem. Is from three main structure problem. The first, fat accumulation, is make you have a double chin. Too much fat accumulations, and the muscle tones hyperactive and loose can make you have a vertical band. And the last one is skin quality that we're talking about today. So remember, everybody doctor knows it really defeats the master. Why you say defeats the master when you want to treat the neck areas? Because you can see, everyone knows that the skin really thins. And we have to stay superficial plane all the times. I will show you the average of the skin thickness. We have know the skin under the eyes. It's very hard to do because it's so thin. Yes? When you inject something, it's easy to make lump because you move all the time. The same as the neck, but the neck is thinner. 0.8, but here 0.5 millimeters. Moving all the time. When you're talking, eating the food. Yes, that's right. So that's a big problem. When you inject another things, it's easy to make lump. I've heard that previous talking about filler migrations. Dr. Kwan's talking about when you inject the fillers. Some kids have not good result because of the filler migrations. Because of the skin very thin here. And then danger area effect. Everybody know we have a trilocin here. It can make the problem about the systemic. When you use another medical device like a RF or many things, we have to avoid this area because it can make injure. When injured, the systemic have a problem. Is that right? So, when you inject too much toxin, can diffuse hard to swollen, hard to respiratory, because it affects on the accessory respiratory muscle. That's right. So big problem. So that's why I say the limitation in technique or the methods that this neck area defeats the master. Yeah. So what should we do? What to try to treat? This is a partismal band, so thin. It stay on the hypodermis when it's thin here. So remember that the problem of the neck affect on three main structure. The first one is fat. The second is muscle. And the third one is skin. Yes. First, so we want to overcome, improve the skin, improve the sagginess, improve the muscle band, to down the visible here, and improve the skin quality. This is overcome. We want to. So many people come to you with a turkey necks. Yes, look like turkey. But the first of all, we have to stage. Because we have to stage. Why? We have three main structure, but only one fit or no. No. So we have to know what's the problem and treat to the direct problem and to make the fantastic result. Is that right? Yes? Yeah. Okay. The turkey neck, the fat accumulations, and here, if we do only injection like a toxin or a biostimulator, yes, it's improved on only the skin plane. But the main problem is fat. So we have to remove excess fat to eliminate fat with liposuctions, or we have to do sorry, fat, what you say? Kyphoscoliosis, like that. And the muscle sometimes. The problem is the type of the platysma also. So we have to, but sometimes we have to do the surgery like a platysmoplasty here. So, and neck lift here. We have too much excess skin. At the neck treatment of the muscle band here, the vertical line here, it represents of too much visible of the platysma band. So we have to do injections of the toxins. So when you feel like this here, we have to inject. But I'm telling you that be careful because it's two things. If you inject too deep or inject too much toxin, we maybe have a problem. So how about here? Skin quality. And today we will talk about the PDO microsphere, the neck rejuvenations. Yes, the neck rejuvenations. Nowadays, which one you choose in your clinic, for your customer, for your patients? Some people use a biostimulator, laser, pico, abrasion, HA, or PRP. Today, we do our for neck to overcome skin thickness, hydrations, improve elasticity, and improve the colors. So remember that we have to staging before. If you want to do only the skin, we want a dramatic result, we use only here a rocket of the problems. And the cluster 3, 4, 5, 6 maybe need more. Fat accumulation, we have to fat. Muscle hyperactive, decrease the functions of the platysma band. You have to use toxins. And this is a good candidate for injection for skin. So remember that skin and neck skin very thin. So be careful, stay superficial plainly. And we talk for a long time to come here to sharing case, the first case. The first case is 38 years old. The sharing, I just want to sharing, comparing in material. Everybody knows that PDO microsphere could help the skin quality. But the previous time, before PDO microsphere come to Thailand, we used a PRP, we used a HA before. Yes, thank you for Dr. Kwan's. The product's very good, thank you. And coming to Thailand already. So I just want to compare PDO microsphere, the solutions. I use totally 6 cc for dilutions. Here, like this. And comparing 20% non-closing higher. I will show you here. I inject here. Other core, 200, 1 bottle, dilute up to 6 cc. Injection submental areas 3 cc, and a half inject on the right side of the patients. And the left side, I use HA non-closing 12%, 2 cc. I will show you the result immediately. How you think about the result immediately? How you think which side is better? You think about right side? Or you think about left side? Yes, at the first time, left side is a little bit better. Yes. And I follow up for 3 days. Well, boost. Sorry. And which one is better? Slightly here? Yes, I think so. Slightly here. But after for 1 month, I follow up and check again. The right side and the left side is not significant difference. Yes? The same? The same. But then one thing I want to show you, the pin skin test. This test is for test the skin elasticity. When your skin is used, it's fully coin. but you're getting old. It's not fully recovered. Remember that you side down after morning, you sleep on your side, and wake up in the morning, your grandmother and your mother sometimes have a wrinkle, have a static, like a fro not required, right? That's the meaning of the skin quality. And after 1 month, I would show the first case. I take a video to show that how can record of elasticity, because it's represent of the good skin quality, is that right? Yes? And I will show close up to you. This is HA. Me. Whoop, whoop, slow motion, please. Whoa. Remember here? You can see a little bit not fully core. And 𝚑𝚐𝚗𝚒𝚘𝚗. Show up. Slow motion, please. Before and after 1 month. You can see better in the core. That's right. So what's the meaning? As remember at the first time, immediately after, 3 days after, the left side of the patients a little bit better. And after for 1 month, we check for elasticity by pinch test. The result like this. Yes. Oh, so hungry right now. No, I know. I will go fast. Okay. And this is the submental areas. I will show you the pinch skin test. Slow motion, please. I think the record is better, much more better, much better. Yes? What's the meaning? And this is the skin quality that we want to be, yes? And the second case? And the second case, a male, 35 years old. And this is the last case, I promise, last case before lunch. Sharing neck rejuvenation, but this time comparing in technique. I just want to compare in technique. This video, the right side of the patients I use along the lines. I try to, and another side I use to, imagine that if I use a PDO thread, I want to stress the skin. But I just want to try to use the PDO microsphere to test what is work as a thread, PDO mono thread to stretch the neck skin. So I just want to test how different. Yeah. And I use together just only PDO microsphere solution 200 also, and dilution for 3 and 3. 1 bottle dilute up to 6. Separate right side for 3, left side for 3. And I'm talking about the patient friendly, the doctor friendly, and recovery times. I use in separate technique, and this is immediately after. Can you see the difference? Which one is better? Here, across the technique right here. Because I copy a motor thread to stretch the muscle, but after 1 month, the result is here. It's different? Same? Which one is better? Here? And you see here is better. A little bit better before. Agree? Yes? Yes, thank you. I will show you. Okay, try to, yes, so fast because so hungry right now. Okay, I will show you the video here, okay? What should I do? Okay, video, elasticity, right side and left side by pinch skin test. Can you see? Can you see? Sam. Or this one better? Or Sam? Oh, the same? Too fast. Again. Okay. Again. Slow motion. Slow motion. Okay. I can order them. The same. Huh? The same? The same. So, in case, the first case, I try to conclude. HA is good for hydration. So when you're getting old, the hydration is drunk. So when check at the first time, the hydration is very good in HA. And PDO microsphere is good for elasticity because I test the pinch test. It's used to improve the skin elasticity, to firm the skin. But we have to wait for the times. 1 month to collagen stimulation and have a new collagen synthesis. And the second case, across and along the technique, the result at the end, elasticity is the same. I think across the technique a little bit painful. Or at the first time is like a better in the cross technique, maybe swelling or so. So we have need just 2 cases in comparing the same person. So we need more N to check up against this to make a statistic. Any questions before launching? Okay. Those are dialects. Okay, thank you to everyone. And Dr. Beam just want to say thank you to you for your attention.
If you remember when I told you about the PDO has a great stretching effect. So that is totally different from other materials. If like a PLLA, if you put more, you might have a more lumpy or nodules, but PDO will never happen. So when I inject also under the eye, some doctors, they think they will just put in the sunken area here, okay? The ultra-cold PDO. But it's not, it will have an effect, but if you want to have a more better effect, you have to put it on the eye and a little bit lower, so you have to spread it so they will have a great stretching effect and you have the better result, okay? So anyway, so thank you for your exciting lectures. Thank you, Dr.
Okay, so next we will move to the live demonstration, but while we are setting for the live demonstration, we will allow to ask the question like 5 to 10 minutes. If you have any question for our 5 speakers. คำถามไหมคะ Okay, so I will ask Dr. Korn first. Because as far as we know that the safety is come first.
Yes.
Okay, for the PDO. But I was wondering that because the degradation time of the PDO is around 4 to 6 months, comparing to the, like PLLA is around 2 years and PDLLA is around 1 year and a half. Do you think that is this the disadvantages of the PDO because it's dissolved very quickly?
Yeah. Okay. We are not really after the volumization with the PDO powder, and we are not really after the long lasting because PDO thread absorb in 6 to 8 months time, as you know, but this PDO powder we absorb in 4 to 6 months time. That will not last 8 months because it's a microparticle.
Exactly.
So actually, when they go in, after 4 months, actually the PDO ultracore is totally gone. So then how they produce the volume? Because of the collagen they produced, okay? But PLLA, they last 2 years. They stay there 2 years, okay? So I told you the PLLA is not the true volume by the collagen, but they are, because of the hardness, they produce the volume. That's why you have to wait, you have to wait after 2 or 3 sessions, they see the good result. But PDO, if you remember the hand, one hand the test, we shoot one vial on the left hand only once, but it lasted more than 2 years. I mean, the beautiful, collagen stimulated hand lasted 2 years. So sometimes, I also trying a lot. One time I shoot more, or I divide into many sessions, but depends on the areas. So actually, if you want a good result, you can just shoot like here for the neck. I usually shoot 1.5 vials, but you can shoot 2 vials. Then you can see the result lasting much longer. And don't worry about the problems lasting, complications lasting, nodules or granulomas, especially other areas, it never happens. Only some area, especially under the eye, if you shoot a little bit more, you have a lump-like. But the other area here, even you shoot many, it never happened with a nodule-like or lump-like problem with a PDO.
Okay, so it's the safest, but however, you may need to repeat sessions. And Dr. Kwon will use 21 gauge cannula with 60 mil length.
For the hand, I use 23G cannula 5 centimeter. And for the neck, I use 21G 7 centimeter cannula. Some people use 7 centimeter cannula 23G for the neck. But for the neck, you have seen the video, looks like a thin, so looks like a easy to go in, but actually very fibrotic. So it's difficult to go in, That's why I have to use 21G, 7 centimeter. Yeah, it will be much easier to go in. Because 23G is still very shaky. For the face, I use 23G 5 centimeter. I always tell you, better not use 25G because also very shaky. And if you go sometimes too thin and shoot, sometimes they leave a line. There are some cases. But of course, they will disappear, but they have lines, okay? So better, also remember, when you do the cannula, make the bevel down, not on the up, okay? Bevel down. So if you shoot bevel down, you shoot, they will spread down, something like this, okay? So only the few things. Okay, so for the neck, we do the neck first. For the neck, our entry point will be from the ear bowl. We go down straight, but you have the vein here. Can you see the vein? So just be careful not to touch the vein. And you have the SCM muscle here. So the entry point will be right front of the vein, and also the 2 entry point here will be along the wrinkle line, okay? Along the wrinkle line, okay? So give me the gloves. And if the patient is older, then we have to make one more puncture line here and to cover the double chin and this area. And the middle one cover the mid area, and the lower one cover the lower area. But we go basically a little bit crisscross. So here, yes. So we can cover all the areas. Okay, so our entry point. Can you clean? I cannot see. Okay. Enough. Okay, our entry point will be from the ear bowl, go down here about 2 centimeters below, and this is a lidocaine with the epinephrine. And here, another second entry point. Yeah, here. On the lines, okay, on the lines. And actually, you can see the veins. If you are really afraid, then you can go right in front of the vein. So we have a third entry point. For me, I use 4 cc dilution, but some of the doctors who use 5 or 6 cc, but I don't want to use to dilute, because if you dilute too much, you will have a less effect. And it will be, for example, you do 1 vial, 1 vial, 1 vial for 3 sessions. Which one will be better? 1.5 vial, 1.5 vial for 2 sessions. In my opinion, 2 sessions with more amount is better, okay? So make a puncture. Seven centimeter cannula.
27ใช่ไหมใช่ค่ะ
Okay, so this is a 7 centimeter cannula, 21G. As you can see, it's quite long. So we're going to do something like this fan technique, okay? This is so easy. Make sure cannula bevel down. If somebody can stretch from the other side, it will be much better. But anyway, see, go inside. You can reach up to the double chin area here. Can you see the end? So always remember retrograde injection, okay? Please make a habit. Never inject while you are introducing, okay? So in this way, you never have a vascular problem, especially this is a 21G. It will never puncture any blood vessel, don't worry. It never happened. And then, every line, please make sure you inject 0.1 cc or 0.15 cc. In this amount, you never make a lump, okay? So, look at this one. We
Which
draw.
plane did you inject? Which
Pardon?
plane?
Always subdermal. We are after the right below the dermal layer, okay? Because we are after collagen stimulation. We don't go deep into the muscle layer. So shoot, okay? And make sure you shoot continuous pattern, okay? Look at this one, continuous pattern, okay? Continuous pattern. Look at the speed, okay? So you have to practice. Please, especially with this PDO, don't shoot and stop, shoot and stop. No, this is a very bad technique, okay? Even you are using the needle, please don't do that. So make it continuous. Why? I have the answer before. It has a great stretching effect. If you shoot like this, it's like you leave one thread there, okay? So, okay, again, we go in superficially here. Can you see? It's very stiff. You don't think neck is very soft. You know, no, neck is a very fibrotic area. That's why if you get older and you put the HA filler, 30% clean. 30% they have some effect with the HA fillers, but rest of them all getting older, the neck wrinkle line will never filled, but they will migrate up and down. They have the little bit lump-like lines along the wrinkle, up and below and up, upper area. So here, see, go crisscross, shoot, go crisscross, shoot, go crisscross. You see, very stiff, you know. Do you feel the pain? Jeb, May Jeb or May Jeb? Her name is Jeb. Okay, so it's finished. So this is second one. I go from the middle. If you want to improve this wrinkle, I will go okay, here. I will go along the wrinkle, okay? This is she has 2 wrinkles here, horizontal wrinkles, one and the other one here. So I will shoot a little bit more along the wrinkles, okay? A little bit more. And then I go a little bit up, a little bit up, and a little bit down. I go down up to here, shoot, shoot, shoot. Finish. You can finish within 1 minute, okay? So if I don't talk, I finish already. You know, UltraCore has an amazing profit to your clinic. Why? One patient you finish in less than 5 minutes, 10 minutes. And then you have the great improvement. Do you think you have any product like this? That's why nowadays I'm lazy to doing thread lifting, you know. You see this area is very...
Dr. Kwon, how many sessions would you recommend in the next area?
For the neck, if I'm going to use a 1.5 vials, usually I finish in 2 sessions. But of course, I usually tell my patients like this.
So 2 sessions in 1 month apart.
No. 2 sessions in 2 months. If I do today, after 2 months. And if I'm going to do another session, after 3 months. Of course, the more we do, the more better effect, because we need to make a more profit. You have to puncture with a 20G because this needle is a 21G, so it's a little bit difficult to go in. Yeah, you have the yellow needle. Please give me the yellow needle, yes. Because in Korea we use the 20G needle for puncture, but here you have the 21G. So some area is difficult to go in. Okay, so we are in. So can you see here? This is along the wrinkles, okay? Along the wrinkles. I show a little bit more, and I go down a little bit. I go down a little bit. Can you see it's a very fibrotic? So neck is one of the difficult area, thin and fibrotic. So you have to break the fibrosis with a little bit dissection like this, okay? A little bit dissection. Then the result will be much better, okay? Because if you do dissection before you shoot, of course there is a lot of pain. So after I inject once, this UltraCore contains lidocaine with the epinephrine already, right? So I wait a little bit and I do dissection. She don't feel the pain. So we are done on the right side. Can you sit up? And actually, if you want to improve the wrinkle, the horizontal wrinkle, I have to use more UltraCore 100, and I inject intradermally, then I will have a great improvement. But the one thing, you remember Dr. Beam's lecture? The thinnest area, the thinnest skin area is the neck. So if you inject, even though UltraCore PDO is very safe, still if you inject too much in the superficial intradermal layer, you might have the lump-like. So to prevent this problem, I'm going to mix the non-cross-link HA 50% and UltraCore 150%, and I inject along the wrinkle lines. Then usually we don't have this lump-like problem. Of course, you can mix other skin boosters. In Spain, they use the non-cross-link HA with the succinic acid. Have you heard about this product? And also, you can mix some other skin booster like Exosome. Depends on the country. If you can inject, if you mix it, then you have the best result. Even one session, you will see the magics. Okay, how do you feel? How is the pain grade? 0 to 1 to 10. 10 is the most painful. 4, okay. So we will not treat the left side because she has too much pain. And the real effect will come after 1 month to 1.5 months later. Do you know the collagen stimulation, one session will be starting after 28 days. So actually the real effect will come after 2 months. Okay? So, any questions so far? You know, I've been using PRP since year 2008. I first introduced the PRP here 2008 with Dr. Achima's convention. And then I use a lot of fractional lasers. I use a lot of, PRP and those products here on the neck. But I tell you, this is the best. You can try, just like Dr. Bim did. I love to do half face with the other product, half face with this product. So that's how I, come up with which is the best. So I tried all the exosome in Korea. I also did half face with this exosome, half face with that exosome, and I have the answers actually. Try the UltraV exosome. Okay, let's do the hand, okay? Drink? Where's my drink? Not there. You know, we did so many interesting studies. Also, one of the famous doctor, he shoot only one hand with the ultraco, one wire, only one times. So he tested how long it lasting. And then, only once, now it's 3 years already. 2 years after, still the one he shoot left hand is better than the right side. And then now it's already after 3 years, still the one he shoot on the left hand is better than right hand. Okay? So I tell you, once you did a proper collagen reconstruction under the skin, that will last very long. Okay? You have to understand. It's very important. It's not like a Botox. It's not like a filler, lasts 6 months. After 1 year, go away. No, it never happens with the collagen stimulation. So you have to make a good collagen stimulation with a good design. It's very important, okay? Okay, let's do it. Stay there. Thank you. Okay.
อะไรคะเผื่อพี่ตีส่งของ
Okay, so it's very easy. You will make an entry point here between the second and third, but she has a vein here, so we go a little bit to the left to avoid the vein. And this is the entry point with a lidocaine with the epinephrine, and this is a third and fourth. Okay, and this is a between fourth and fifth. Okay.
So how much dilution are you using?
I always use
1 to 4?
dilution.
1 to 4.
I just control the amount, because if you make a more dilution, more swelling, but it doesn't mean the effect is better. So in my experience, 4 to 5 cc dilution is the right dilution. Of course, doing the body, I do 6 cc dilution. Like a hip lifting, I do 6 cc dilution for me, because it's, otherwise I have to use too many, too many vials, too expensive. So, okay, so make a puncture, gentle puncture, gentle puncture. It's so easy, okay? Gentle puncture. Okay. So I 5 centimeters.
แต่ว่า5 เซน
So I'm using 5 centimeter 23G cannula. So bevel down. It's a simple fan technique, okay? Just go slowly, no power. Just go slowly. And remember, every line you shoot 0.1 cc or 0.15, then you are very safe. So shoot slowly, 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 and then go a little bit slowly, 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 slowly. And between the digit, I can shoot a little bit more, okay? Because to fill up the collagen in that space more, okay? So I'm doing very slowly, and here we move to a little bit. You see, you can hold the hand and move the hand and find a good place and make it bevel down, remember, and spread it. Finish. See? If she's older, you have two choices. I mean, you can put one wire on one side of hand, or you can combine the UltraCore 100 with some exosome skin booster on the superficial skin. I mean, those patients with the fine wrinkles, you know, a lot of wrinkles, you can do some superficial treatment as well. So bevel down, okay, and go to the other side. So this is a fan technique, okay? Small, slow withdrawal injection, okay? And those areas with the sunken area, I mean, between the digit, you can shoot a little bit more.
So you are also in the subdermal plane?
Yes.
So this is not the plane that we are inject fillers. This is a little bit superficial.
A little bit more superficial than fillers. So, finish. You see, you can finish one area less than 1 minute. And
Very fast.
yes, I can charge. It's a minimum $1,000 to $1,500. Okay? So she will pay me later, okay?
So usually, how many cc do you use per one hand?
Usually depends on the age. Let's say 30 years old, 35 years old, I inject only like a two entry point, and I shoot half vial. But let's say 40, 45, something like that, below 50, I inject 1.5 vials. Let's say she's a 60 plus, then I shoot 1 vial each hand. Okay, so here I go again, shoot small, 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 small. So fan technique and continuous injection, okay? Continuous injection, shoot. Very easy, okay? If you've been doing fillers, it's a chicken for you, okay? Fried chicken. Korean fried chicken, chimek.
So
Finish.
in the aging patient, like mature patient, usually do you combine with the fillers because you may need the volume also, like the patient may require also volume.
But nowadays, if you put the filler, you know, it looks a little bit unnatural, you know? Even you put the fine filler, still you have some bulky look. And actually, if you do this one, it will produce also natural volume. It's quite strange. So PDO produce natural collagen volume, and they don't never look over correction, you know? Okay, so we are done. We will do her only one side. So we will see her after 1 month and 2 months. Okay? So we can have a good record before and after. So it's really completely done, okay? So you finish the hand and neck usually within 10 minutes.
In your experience, have you noticed some improvement of pigmentations also?
Oh, yes, yes. Oh, that's quite interesting because we have been shooting UltraCore on the face, and a lot of patients improve the pigment. So we don't know yet but we can have some ideas. In the ultracold, this increase huge influx of the blood flow. They increase a lot of vascular circulation. So maybe also they attract a lot of growth factors as well. So maybe that's the reason they improve the pigments. We have so many cases. We only shoot the ultracold, but they improve the pigments. Of course, some very old and very dark, sometimes difficult, but we have many interesting cases. And also right now, we are doing the ultracold 100 for hair growth, in Seoul National University, which is a top first university in Korea. We are doing the hair growth clinical trial. So also we can assume, ultracold 100, very small particle, they inject here, and they huge increase of blood flow and huge increase in nutrition. Maybe that may be the cause of the growth of the hair. Okay, and also it's a quite interesting result. So we just finished the hand, as you can see. So how is the pain grade, 1 to 10?
5.
More pain than neck? Are you sure? Oh my God. She's not a good patient. Don't treat this kind of patient next time. Usually 3 and 4 up and down. Any more questions?
Is there any obstacles or something that you need to warn the patient when you use ultracold?
Actually, we didn't see any severe complication past 4 years.
Except expensive.
A little bit expensive, but much more safer. Because nowadays, I emphasize again, nowadays in Korea, Gangnam, Gangnam is the most expensive place in Seoul. In Gangnam, people go under eye, dark circle, ultracold. That's already kind of a, so people, before my patient was about 35, 40, 50, 60. But now my patient, general age, is 25 to 30. They all do under eye. Okay, so if you have a chance, you can come stay with me in my clinic for 2 days, observation training. I can show you exactly what I'm doing. So my patient age become much younger than before. Before my patient, all the patient, lifting, thread lifting. But now my patient, all 25, 27, 30, 35, very young. So we opened another blue ocean. I always tell you, we have to open a new market, okay? So this will be good for us and good for you, good for me, good for everyone. So this is a kind of product that opened the blue ocean right now in Korea.
Okay,
Hey,
so
thank you.
please give Professor Khan a big applause.